One other topic I wanted to ask you about was something that is now makes up for, again, laymen, a big percentage of the conversation about coronavirus is masks. So you're a doctor, you've presumably worn masks for some time.
I've got one right here.
You do?
Yes, I do. I wear it when
Yes.
I see my patients. Here it is. I have a homemade mask. I also carry in my pocket a cloth mask, which I wear outside the hospital. And I have an N95, which I wear in the units, the wards. This is my cloth mask. I wear this when I'm outside. So yes, masks are extremely important. All the nurses here wear masks. The receptionists wear masks. The patients are stopped at the door and not allowed to come into the clinic until their temperature is taken, and they are not allowed to bring a relative in with them. So it's very important to wear masks. It's basically a gift to your friends. When you wear the mask, you're saying, I'm protecting you from me, and you can protect me from you if you're wearing a mask. And keeping the safe distance is important, unless you have a wife and kids who you know are not infected, or a grandmother and grandfather who you've been with for several weeks. It's best to wear a mask and keep social distancing, and of course, wash your hands. I wash my hands before I see a patient and after I see a patient, while I'm wearing the mask and keeping the social distance.
Yeah. Well, one thing that I've been wondering is we read, especially early on, that there had been a lot of cases of doctors and nurses and other people working in, on the front lines against the pandemic becoming infected with it. There were many deaths, especially early on.
Yes.
As you've seen this politicization of wearing masks, leading to some individuals choosing not to as a sort of political stance, with the possibility that that could lead to future infections, knowing that people like you are the ones who are going to be fighting against a second wave if it comes, what do you think about that becoming this sort of cultural or political thing rather than purely a function of doctors advising us on what we should do to maintain good public health?
Well, public health should never be politicized. Wearing of masks should not be a political statement. And I'm aware of this. I've been told that conservatives don't wear masks and liberals wear masks, and that's baloney. It really shouldn't even enter into the equation. All you have to do is have one person die because a mask wasn't worn in a bar, say, or a clubhouse, or even a gym. I can't imagine being in a gym with everybody grunting and sweating and yelling and spitting, and not wearing a mask on the treadmill or the elliptical or whatever you're on. That to me would be ridiculous. So this politicization of wearing masks is unacceptable. As far as the medical community is concerned, it's ridiculous.
Yeah. Well, I certainly agree. And Dr. Lahita, we really appreciate you joining us and making sure that our audience knows what's actually going on, the updated information. We really do appreciate it.
That's great. And thank you for having me. I appreciate it.
For more political news breakdowns, interviews, stories of activism, and me trying my hardest to care about the occasional big celebrity news story, subscribe to our YouTube channel at youtube.com/thedamagereport. And you can ring the bell wherever it is so you don't miss anything.